The coronavirus surge, triggered by the winter holidays, appears to be slowing down. Cases, hospitalizations, and deaths have fallen over the past month, but dangerous variants are the latest threat to our shared recovery. There are now nearly 1,000 cases of the more contagious strains found in the UK, South Africa, and Brazil. They've spread now to at least 35 states. Health experts say the key to getting ahead of the spread is vaccinating as many people as soon as possible. More than 33 million Americans have received at least one dose of a coronavirus vaccine, and more than 10 million have received 2 doses. Carter Evans reports.
Tonight, a disturbing new COVID development in California, the arrival of the more aggressive variant, first discovered in South Africa.
2 cases have been reported through Stanford, one in Alameda County and one in Santa Clara County. The issue of mutations is top of mind.
The number of known variant cases in the U.S. spiked 73% in the last week alone, with 5 states reporting the South African variant. Another strain first identified in the U.K. is now in 34 states, including Florida, which has seen nearly a 50% increase since Sunday. University of Miami pathologist Dr. David Andrews is trying to track the variants.
I really want to increase our ability to sequence more of this virus to understand more about its biological behavior.
Infectious disease doctor Jonathan Lee tracked an immunocompromised patient in Boston, sick with a COVID variant for 5 months before he died. During that time, the virus inside him mutated more than 20 times.
More rapid viral evolution and mutations can develop in these individuals, and that we really need to be paying attention to them.
And there is promising news on double masking. The CDC now says wearing a medical mask under a cloth mask substantially improved containment of COVID-19 and can also protect the wearer from infection. CBS News chief medical correspondent Dr. John LaPook.
These experiments from the CDC were remarkable, and they showed that if you wear 2 masks and they're well fitted, that's the key thing, that you can have more than 95% protection from the aerosols that you otherwise might get.
The U.S. just hit a milestone. 10% of the population has now received at least 1 shot, and new mass vaccination sites are going up around the country, including the home of the Mets in New York City, where people waited in the cold for a shot.
If I have to wait here all day, as long as I hope for the best and we both can get it.
This is one of the mass vaccination sites in the L.A. area that is now only giving out second shots in order to conserve vaccine supply. New data from the CDC obtained by CBS News now shows that 96% of Americans are receiving that second shot on time. Lana?
That is good news. Carter, thank you. The nation's 3rd largest school district will resume in-person learning this week. Teachers in Chicago were able to reach a deal with the school district, but other districts across the U.S. remain divided. Meg Oliver reports.
I missed her smiling faces. I missed her energy.
David Malone teaches 3rd grade from his basement every day. He's been doing it since March.
Do you want to return in person? 100%. Absolutely. If all safety measures are met, then I do want to go back to school.
Malone is one of thousands of Philadelphia teachers demanding upgraded ventilation systems and vaccinations before they return to classrooms. Philadelphia Superintendent William Haidt says students are suffering.
Quite frankly, they're isolated. And we are starting to see the negative effects of that all across the country, with children being depressed.
But tonight, it seems the White House is lowering the bar on their plan to reopen the majority of the nation's K-8 public schools within the first 100 days. Now saying more than 50% of schools need to have at least 1 day a week of in-person teaching instead of fully reopening.
That is our own effort to set an bold and ambitious agenda for how we're going to measure ourselves and progress. But we certainly hope to build from that.
CBS News has learned the CDC will release guidance for schools that will likely focus on 5 areas, from basics like masks and school cleaning to ventilation. But even if schools do reopen, there are some parents who won't send their kids back, like Bader Lilly in Philadelphia.
My daughter in particular said that if they don't have soap and hot water on a normal day, what makes you think they're going to have soap and hot water in a pandemic?
Meg Oliver, CBS News, Philadelphia.
For more, let's bring in Dr. Richard Besser. He is the president and CEO of the Robert Wood Johnson Foundation, and he is the former acting director of the CDC. Dr. Besser, the CDC now says that people who are fully vaccinated no longer have to quarantine if they're exposed to someone with COVID-19. But the rule may be a little bit confusing to some since it only applies to people who received their last dose less than 3 months before they were exposed. Help us to understand this. Do vaccines only offer a 3-month window of protection?
Well, Lana, it comes down to what can we say right now based on the science. It's nice to see the CDC coming forward with some of the benefits that there are to being fully vaccinated, because it's clear even if you're vaccinated, you need to continue wearing masks. But this news is I think very welcome. So if you've been fully vaccinated, it's been at least 3 weeks since you've had your second dose of vaccine, and you've been exposed to someone who is positive for COVID, you don't need to quarantine unless you have symptoms. That's great. That means that you don't need to spend those 10 days or 12 days or 14 days wondering whether or not you are going to be infected and changing your lifestyle in terms of what you can do. I expect that as months go on and there's more data looking at protection longer than what was required for the emergency use, that they'll extend that beyond the 3 months.
Rich, I want to follow up with you on two of the things that you said. First of all, does this mean that that the CDC believes that if you have been fully vaccinated, that you are unable to transmit the virus?
Now, that question is unanswered. What they're saying is that if you've received your full vaccination, the level of protection from these vaccines is very high, and so you don't need to be quarantined to see if you develop symptoms. And over time, we'll see about whether or not it's still possible to transmit. I think it's probably less likely that you would transmit, given what we know from other vaccines. But what they're saying is you do not need to quarantine.
And you also mentioned that somebody who's been fully vaccinated, that you're recommending that they should still wear a mask. Why is that?
Well, it again comes. I think there's several reasons for that. One is that at this point, a very small percentage of people in our country are fully vaccinated, and it signals that we're all in this together. We need to wear masks to protect each other. The other piece of that, as you were saying before, is that the question about could someone who's been fully vaccinated transmit to someone else has not been fully answered. And so wearing a mask, even if you've been vaccinated, will help in that circumstance.
Thank you for clarifying that. Now, new data is showing that 96% of Americans are, in fact, receiving their second vaccine dose on time. I remember you and I discussing whether or not that was going to actually be the case. So this is good news, but still, there are several states that say that the vaccine rollout is not moving fast enough. There are plenty of people who have been trying to get vaccines, who are eligible for them, who haven't been able to get them. So what are currently the biggest obstacles to getting more people vaccinated in this country?
Well, the biggest obstacle is undersupply. And, it's absolutely miraculous that a little over a year into this pandemic with a newly discovered infectious agent, there are 2 vaccines that are being administered across the country, and tens of millions of people have received them. But it's going to be several months before there's enough vaccine for everybody who wants it, for everybody who needs it. And that leads to frustration. I don't think there was enough messaging done from the beginning to set people's expectations that even if you're in an eligible group, it will take time for there to be enough vaccine for people in those eligible groups to be vaccinated. I worry that in many states, essential workers, frontline workers, are not part of the groups that are being included in vaccination. And one of the reasons that essential workers were being recommended by the CDC and by the National Academy of Medicine is that a disproportionate number of people who are working every day, leaving their homes to go to work, are people of color, Black Americans, Latino Americans, Native Americans, who are being infected, hospitalized, and dying at rates that far surpass the proportion of the population. So if you're not including those groups, if you're just going by age, you are going to be under-vaccinating groups that are bearing the biggest brunt of this pandemic.
An important point, because we do know that there are several states in which the priority groups are simply those based off of age, and we do know that there are other states that have been more successful in vaccinating wider groups of people. Rich, I want to ask you a little bit about some of these variants. A World Health Organization panel says the Oxford AstraZeneca vaccine can be used even in countries where variants are circulating. This comes after a study showed that the vaccine was less effective against the variant first found in South Africa. How concerned are you about these variants and the ability of vaccine manufacturers to stay a step ahead?
Yeah, if that vaccine is brought forward to the U.S. for consideration of emergency use approval, the FDA is going to need to look hard at the data. My understanding as to why South Africa didn't want to recommend that vaccine is that it was shown not to be very effective against mild to moderate disease, and there weren't enough people in the trial who had severe disease to know whether it was protective there. If it's found to be protective against severe disease, then I could see that there would be a value in having it, since our goal here in vaccination overall is to save lives, prevent severe illness and save lives. So it'll be important to look at the full range of data. If the WHO made that recommendation without having any data on severe illness, I would find that a little confusing. So I hope that there was more to it and they were looking at a broader set of data than the small studies that were reported out of South Africa.
So, Dr. Besser, you are an infectious disease expert. You're also, though, a pediatrician. So I want to ask you about schools. New federal guidance on reopening schools is expected this week. And sources tell CBS News that the guidelines will focus on COVID mitigation, like masks, social distancing, and cleaning, instead of relying on vaccinations. Why wouldn't vaccines for staff and teachers be a prerequisite in these schools? And can you remind us what the data shows about transmission among children?
Yeah, as a parent, as a pediatrician, I know how important it is to get children into school for learning. We're seeing incredible disparities across the country in terms of who has access to schools and who doesn't, with lower income communities being hit the hardest. But it has to be done safely. And some of the good news coming out of this pandemic, both from studies in the United States and studies around the globe, is that with the proper measures in place, you can have children learning in classrooms safely. Safe for them, safe for the staff, and safe for the teachers. It means that schools need resources, and we know that there are a lot of schools that don't have the resources they need. Resources to hire staff so that they can screen teachers and students and staff for illness when they come to school, staff to be able to do proper cleaning. You need to be able to ensure that everyone's wearing masks and is able to keep apart, and that you can decompress your classroom somewhat so there isn't as much, so that there's a greater distance between each student. If you can do those measures, what they've found in schools that have opened across the nation is that schools are actually some of the safest places for children to be. The rates of transmission lower than what's going on in the community. I think teachers should be included in the group of essential workers for whom a vaccine is made eligible. But I don't think you need to wait until all teachers are vaccinated before they are back in school and providing in classroom teaching. Both are important, but it's very exciting to see that other nations have been able to keep schools open, and schools in the United States have been able to do it quite safely.
Well, you know my opinion that teachers are absolutely essential. Let's talk a little bit more about mask wearing, because the CDC is now recommending double masks after a study found that they can block more than 92% of infectious particles. Are you currently wearing two masks when you go out in public? And does this mean that single masks simply aren't as effective as we thought?
Yeah, so the CDC updated their mask guidance today, and what they wanted to focus on first is that people should be wearing masks. Even with a single mask, it reduces the likelihood that you will spread COVID to others, or that you will be infected by COVID if you're around someone who has the infection. What they reported on today in their new study is looking at, well, is there added value in having two masks? And the focus here was recognizing that in addition to wearing masks, how the mask is worn, how it fits on your face is really, really important. So they're recommending a number of things. They're recommending a mask that has a little piece of wire at the top so you can pinch it on your nose so there's no leakage there. And what they found in their study was that if you wear a surgical mask or a medical procedure mask and you put a cloth mask over that, the cloth mask will ensure that there's no gaps around the side of the surgical mask, and it will fit your face better. There are other approaches that you could use. You could use just one surgical mask, and they show how you can do little knots on the sides of that surgical mask so that the little gaps on the sides aren't there. So a number of approaches you can do, but the big point here is that wearing a mask is really important. You don't want to wear it below your nose or on your chin or on your forehead. And there are a couple steps you could take to make sure it fits your face better.
That's really helpful information, because everybody's been talking about 2 masks recently, but it hasn't been entirely clear before you explained it that that's actually to help block out those other aspects of your face where the virus could potentially get in there. Dr. Richard Besser, always one of my favorite people to talk to. Thank you.
Nice talking with you as well. Thanks, Lana.